First, I just want to start by saying I feel really honored to be here today. And my main goal for my presentation is to hopefully give you some tools that you can use to help improve your quality of life. That's kind of my main goal. Hopefully I'll achieve it today. I want to start by talking about some of the healthy guidelines for cancer survivors, and then move into specific recommendations for people with neuroendocrine tumors for symptom management and specific recommendations for nutrition. So the American Institute for Cancer Research recommends that cancer survivors follow a balanced diet that's heavily plant-based. So this means including plenty of vegetables, fruits, whole grains, beans in the diet, including lean protein sources while limiting red meats and avoiding processed meats, following a low-fat diet but emphasizing healthy fats, limiting simple sugars and refined grains, so things like sodas, sweets, added sugars, getting plenty of fluids while limiting alcohol and caffeine, being physically active daily if you can, aiming for a healthy weight. And then one thing that I think is particularly important that I talk about a lot with the clients that I work with that have neuroendocrine tumors is to modify these guidelines as needed to manage symptoms. Some of the health benefits of a whole foods plant-based diet include that it's low in cholesterol, low in saturated fats, and low in oxidants, which cause damage to our cells. At the same time, it's high in antioxidants, which protect our cells from damage. It's anti-inflammatory, which may offer us protection from other chronic diseases like diabetes, heart disease, high in fiber, and then high in other protective substances, so things like vitamins, minerals, and phytonutrients. Phytonutrients are plant compounds that give plants color and scent, and then when we eat them, we obtain a variety of health benefits. So it's really all about color and variety when you're thinking about fruits and vegetables. I wanted to spotlight cold water fatty fish, for example, wild salmon or sardines. Not only are cold water fatty fish rich in protein and vitamin D, but they're also rich in omega-3 fatty acids. And omega-3s are known to suppress chemicals in the body called inflammatory cytokines. Inflammatory cytokines are associated in cancer patients with cancer-related weight loss, decreased immune function, and cancer-related fatigue. Additionally, omega-3s have benefits for heart health, mood, and joint health. So they're pretty important to obtain adequate amounts of omega-3. I recommend eating at least 2 servings of a cold water fatty fish weekly. If that's not possible, consider taking a purified concentrated omega-3 fatty acid supplement from fish oil. I also wanted to spotlight vitamin D. So vitamin D is important for immune function, for our cell health, for reducing inflammation, for muscle strength, calcium absorption, and bone health. And current research estimates that up to 76% of Americans actually have insufficient levels of vitamin D in their blood. You can look at the sources and see why we might be low in vitamin D. You can produce it in your own body when you're out in the sun between 11 and 2 for 15 to 30 minutes before applying sunscreen. How many of you are doing that on a fairly regular basis? Other sources are, again, the fatty fish, eggs, and then fortified foods. A lot of foods are fortified with vitamin D, and dietary supplements are a good source as well. Most adults are going to need somewhere between 800 to 2,000 IUs of vitamin D3 daily. And it's good to ask your doctor to check your vitamin D levels. This is the 25 OH vitamin D in your blood. This will help you determine your need for supplementation if you have adequate levels in the blood. This may be particularly important if you have signs or symptoms of fat malabsorption, which could be chronic diarrhea, fatty stools, stools with foul odor, because vitamin D is a fat-soluble vitamin, and so if you're not absorbing fat, you are more likely to be deficient in vitamin D. Now I want to move on to carcinoid syndrome and diet. Probably many of you in this room are very intimately familiar with these symptoms, but they include flushing, sweating, wheezing, diarrhea, and abdominal pain. And they can occur together or independently of one another. Common triggers are hormone secretions, so this is basically secretions from the tumor, and then certain foods. What you eat, I have to say, what you eat may not be a factor in carcinoid syndrome, but if you have symptoms, diet modifications may help. And so I want to go over some of the diet modifications that may be helpful. The first thing I always tell clients that I see is you are unique. So these diet and strategies really need to be individualized. What works for one person is not going to work for the next person. And the best way to figure out what works for you is to actually track your symptoms. So I encourage people to keep a food and symptom log. This way, if you're making changes to your diet, you can correlate that with a decrease in carcinoid syndrome episodes, so a decrease in flushing or a decrease in diarrhea. It can be really difficult to know what's working and what isn't working if you're trying to modify your diet and not tracking your symptoms. The most common food triggers that have been reported for carcinoid syndrome are large meals, fatty meals, alcohol, very spicy foods, and foods with a high amine content. So amines are basically compounds in foods, and they're associated with an increase in flushing, diarrhea, and bloating with carcinoid syndrome. This was supposed to be yellow, so I just want to say I've got my red light foods, my yellow light foods, and then later I'll show you some green light foods. But you can think about the red light foods. These are foods with the highest amine content. So these are more likely to trigger carcinoid syndrome and could be eliminated or trialed for elimination to see if they reduce your symptoms by eliminating these foods. Now, the yellow light foods, which we'll call our black light foods for today, these are going to have a moderate amount of amines. And so if you're trying to modify your diet to help with carcinoid syndrome, these are going to tend to trigger carcinoid syndrome a little less frequently. You may be able to tolerate small amounts of these foods. I'm going to go to the green light foods in a few slides. But people say, well, what can I eat? So you're telling me don't eat this, don't eat large meals, don't eat fatty meals. What can I eat? So the first thing I say is only avoid the foods that bother you. If you see something on that red light list that you've never had a problem with, never seen an increased risk of carcinoid syndrome, you don't need to avoid it. If you have no symptoms, so if you have a neuroendocrine tumor and you don't get carcinoid syndrome, then I recommend that you follow the healthy diet guidelines that I laid out earlier. If you have symptoms, this is where we want to try to make modifications. So large meals are one of the most common triggers. So I would say instead of doing 3 meals a day, try doing 4 to 6 mini meals. Just cutting down meal size can make a big difference. Some of you may have discovered that. The next thing I would look at is niacin, because with carcinoid syndrome, a niacin deficiency can sometimes occur. And this is basically because the tumor is diverting tryptophan to increase serotonin production. And so what can result is a niacin deficiency. One of the symptoms of a niacin deficiency is diarrhea. So by eating a higher protein diet, high protein foods are really the best source of niacin. That can help replenish. So good sources of protein are fish, poultry, other lean meats, beans, eggs, egg whites, low-fat dairy, and even protein powder. So whey protein, rice protein added to smoothies, oatmeal, that can really help increase protein intake. And the other thing I'll recommend frequently is a low-dose niacin supplement, only 25 to 50 milligrams twice a day. So a lot of people know that if you take high-dose niacin, that can increase flushing. This low dose will not increase flushing and may help replenish if you're deficient in niacin. Additionally, you can take nicotinamide, which is a no-flush niacin. With symptoms, I recommend following a low-fat diet because fatty meals are often a trigger for carcinoid syndrome. So just avoid greasy fried foods. You don't necessarily need to focus on 20% calories from fat, 10% calories from fat. You want to think about where are the heavy hitters of fat coming from. Cheeseburger, pizza, fried chicken, those have a lot of fat. Animal fat, so added butters, added cheese, poultry skin, sausages, things like that. Your fat intake will drop dramatically if you're just reducing those foods in your diet. I also recommend avoiding trans fats, and those are primarily found in processed foods. You can find them by looking at the ingredient label and avoiding hydrogenated or partially hydrogenated, and they're listed right there on the label. And then even though you're going low fat, you still want to include small amounts of foods that are rich in healthy fats, because we do need some fat in our diet. So the omega-3 and the omega-9 fatty acids are very beneficial for our health, and primarily they're going to come from nuts, seeds, olive oil, fatty fish. You may find that you can't tolerate one of these foods. Try another one, try a small amount of these foods. And one type of fat that I encourage for people, this is especially if you're having trouble with maintaining your weight. So if you've been losing a lot of weight, you may want to consider adding in medium chain triglycerides, or MCT oil. This is a type of fat that's digested through a different pathway than most other types of fats, and it may be that you can tolerate this type of fat. You can buy it in a health food store. It'll be called MCT oil. You could add it to smoothies or salad dressings. And it's also the richest fatty acid in coconut oil. So a lot of times people can tolerate some coconut oil or coconut milk if they're trying to gain weight and they want to eat a little bit more fat to do that. It's less likely that it's going to trigger a carcinoid syndrome or trigger some diarrhea. Vegetables and fruits can sometimes be a problem with symptoms. Ideally, we're eating 4 to 5 cups a day of fruits and vegetables combined. I find people have a really difficult time eating raw vegetables. They can cause a lot of gas and bloating. Sometimes Beano, which is an over-the-counter digestive aid, if you take that when you're eating raw vegetables, it can really help reduce the gas. So that would be something to try. Large portions of fruit may increase diarrhea, but you may be able to tolerate small portions. So again, spreading out the fruits and vegetables throughout the day. And I've also found people have better luck with vegetable juices and soups as opposed to raw vegetables. So these are our green light foods. So this came out in green, so that's good. These are foods low in amine. So if you're minimizing the red light and the yellow light foods, these would be low amine foods that really shouldn't trigger carcinoid syndrome and can kind of be some of your go-to foods. I want to just talk a few minutes about strategies for controlling diarrhea, because I have to say the people that come see me, that are referred to me, this is probably the thing that they feel most frustrated, and they feel like it really affects their quality of life significantly. And so one of the things I always say is, don't give up. You never know what is going to work until you try. You might find that you need to keep working on eliminating foods, trying different combinations of foods, trying some of the different recommendations I'm going to have, but you might get that combination. And once you get the right combination, I'm not saying your symptoms are going to disappear, but they might get markedly better. And I've seen people that's happened, and they feel like their quality of life just goes way up. So really need to go through trial and error when you're trying these different strategies. But one thing I'd say is, first look at what are some other causes. I mean, carcinoid syndrome is one cause of diarrhea, but maybe there's something else that's increasing your diarrhea. Maybe you're lactose intolerant, meaning you can't digest dairy products. And this can happen even if you've never been lactose intolerant before, after you've had a surgery, or if you're on certain medications. So try eliminating dairy products like milk, ice cream, substituting in rice milk or almond milk or a non-dairy substitute. You could also try taking Lactaid, which is, they have Lactaid milk, Lactaid cottage cheese, and the lactose is digested. Or you can take Lactaid pills when you're going to eat a dairy product, and that may help control diarrhea. Sugary foods, high sugar foods, especially fruit juices, can be a trigger for diarrhea. So I would say try eliminating those, or try diluting them. Do a quarter juice, 3/4 water. That may really help. And then think about other non-carcinoid causes. So could it be an infection, viral, bacterial infection? Could it be a medication, like you just had a course of antibiotics? Could it be something else that you're eating, like artificial sweeteners that are called sorbitol or mannitol. These are sugar alcohols, and they cause diarrhea and gas in most people that eat them. And sometimes they're added to medications and sugar-free foods. So I would look at your labels and look for those. Pancreatic enzymes may help, and somebody mentioned those earlier in the panel. These can be particularly beneficial if you've had a Whipple procedure or small bowel resection. They require a prescription, and you need to take them with meals and snacks when you're eating your food. And they can also be beneficial for decreasing diarrhea and gas with sandostatin. So those would be something to look into. A few other strategies that I like to pull out of my bag of tricks. Sometimes it's like, what else can we try? What else can we try? So some things that have been beneficial are soluble fiber supplements. Benefiber is one example. This helps to slow down the intestinal transit time and increase the bulk of the stool. So you could take a supplement of a soluble fiber and mix it with applesauce or a very small amount of liquid and take it with meals, and sometimes that can slow things down. Banana flakes and fresh ground nutmeg have also been shown to be pretty beneficial for kind of slowing down diarrhea. And then probiotics, lactobacillus and bifidobacter. These are live active cultures that normally inhabit our intestines, and they help with food digestions. You can eat these in foods, so things like yogurt and kefir have live active cultures. You can also take them in supplement form. And the last is glutamine powder, which is an amino acid. Sometimes this is helpful for sort of healing the gut and decreasing some signs of diarrhea as well. I just also wanted to talk about serotonin in foods, because this is a source of confusion for a lot of people. Serotonin in foods is different from serotonin that's being produced by the tumors. So it's not going to cause an increase in flushing and diarrhea when you eat a food that has serotonin. It will not fuel tumor growth. It will influence the 24-hour urine test. So it's important to avoid foods that are high in serotonin for 72 hours prior to taking the 5-HT1AA test. So I've listed high to moderate serotonin containing foods, and these would be good to avoid prior to taking that test. And I want to just conclude with some resources. And one thing I want to say is I've mentioned, different strategies today and some different supplements that you might think about including. But I always encourage you to talk about these with your doctor. Make sure that they're right for you before you start some of these supplements. Most of the ones that I mentioned are completely safe for people to take, but it's always good to just communicate any changes you're making with your doctors. Some resources, books you may want to look into just about diet and cancer. One is Anti-Cancer and one is Foods That Fight Cancer. These are kind of fun, inspiring books to read. Some great cookbooks that I have listed here that you may want to take a look at. You maybe even have here in your patient lending library. I'm not sure what resources you have, but we have them in our library. And then some websites. So the first two, the Caring for Carcinoid and carcinoid.org, they have information specifically about nutrition related to carcinoid and neuroendocrine tumors. And then the remaining websites are good websites to learn more about diet and cancer that are reputable websites.
Thank you very much. So there's been some discussion recently in the news about cancer cells fueling on sugar, and in particular for pancreatic neuroendocrine tumors, those cells using fructose. Do you ever recommend to your patients that they decrease sugar or fructose in particular?
No. I mean, I generally think it's a good idea for most of us to limit the sugar that we're eating. We know already that sugar's, associated with many different health conditions, eating too much sugar. And I think it's just important. I mean, that was a really interesting study, but we really have to interpret those studies with caution because it's really looking at a cellular study and not really how that applies to humans, because we metabolize carbohydrates and sugars in a completely different way than just taking fructose and applying it to a cancer cell. Our body is going to completely metabolize sugar in a different way. So I definitely encourage my patients to eat fruit, have a sweet from time to time, but definitely not go overboard in sugar.
For patients that are recovering from a surgery, is there anything that you recommend to try to help their bodies heal better?
Well, I mean, kind of getting back to the basics, I would say you definitely want to get enough calories. Calories are just your basic units of energy. And if you're not getting enough, your body's going to utilize any protein and your protein stores, like your muscles, for energy and healing. So you want to make sure you're getting enough calories and that you're getting enough protein. That would be a time where you want to bump it up. You want to maybe eat a little bit more chicken and fish and eggs to make sure that you're getting protein to heal and form new tissues. There's other nutrients that can be helpful for healing, like a little bit of extra vitamin C and zinc, which you could get from the diet. Take a multivitamin, but nothing specific.
Do you have any recommendations for patients for things that they can eat to control or stop tumor growth? Are there any specific dietary suggestions that you have?
You know, at this time, there's not enough research to show that diet, I'm hoping someday that we can say that diet can definitively, slow the growth of cancer. It is exciting to know that diet can potentially express the way our genes can influence the way our genes are expressed. So by living a healthy lifestyle, eating a healthy diet, there is a potential for sending a good message to your body to be a hostile environment for cancer cells to grow. So I would say the healthy diet guidelines that I outlined would be what I would recommend. And not stressing out too much over them. Finding ways to love to eat those foods.
So back to the fatty fish recommendations that you made earlier, does cooking the fatty fish in any way reduce the nutrients?
No, actually you don't lose any of the omega-3 fatty acids when you cook fish. And canned fish, like canned wild salmon and sardines, are actually a really great source of omega-3s too. So.
And for other ways to get omega-3s, are there any things that patients can take besides fish oil? For example, would flax oil be a good substitute?
You can take the plant forms. So the plant forms are like flaxseed oil, walnuts, pumpkin seeds. They do have a fair amount of omega-3s, but the difference is that your body has to metabolize those fatty acids, and humans only do that about 10% of the time. So if you're relying 100% on plant sources of omega-3s, you really may not be optimizing your intake. So I would encourage you to try to get the fish in a couple times a week, or maybe even take a fish oil supplement just a couple times a week to get those fully metabolized omega-3s. They're called EPA and DHA. And if you go just for plant sources, you may not be really optimizing your intake of those.
Great. Thank you so much for joining us today.